On to our next big top story this evening. Southern Nevada hospitals seeing a surge of COVID-19 patients. Thank you for joining us at 6. I'm Kirsten Joyce.
And I'm Denise Valdez. Some nurses are trying to send a message to hospital administration. The I-Team's Vanessa Murphy has been receiving information from hospital insiders, and she joins us live tonight with more. Vanessa?
Well, usually healthcare workers are hesitant about speaking about work conditions publicly for fear of losing their jobs. But today, a group of nurses is sounding the alarm.
We've been calling them saints, like literal human saints.
Sean Singer's father is in the intensive care unit with COVID-19 at St. Rose Dominican Hospital. On this Wednesday morning, nurses there are protesting.
We want to take care of our patients, but to do that, we want to be safe in doing so.
Registered nurse Zachary Pritchett is a union representative for National Nurses United, which announced this National Day of Action with 200 protests around the country.
I think a lot of the staff feel completely forgotten and abandoned by our leadership.
He and his coworkers are calling for better communication and more adequate personal protective equipment, or PPE. Another concern is the nurse-to-patient ratio.
I work in the intensive care unit where nurses normally staff between 1 and 2 patients. And right now we're working and taking care of 3 patients apiece. And when you take care of 3 patients, it's very hard to give adequate attention to those patients in those critical settings.
The I-Team reached out to St. Rose Hospital, and a representative provided this statement, which reads in part, "We are confident we have the people, equipment, and resources to safely care for all of our patients, including COVID-19 patients." The I-Team has learned hospitals in Southern Nevada are trying to keep up with the recent surge of patients with the virus. According to the Nevada Hospital Association, as of Tuesday, hospital beds in Clark County are 83% full and 56% of ventilators are in use. While visitor policies are restricted, Singer hasn't been able to visit his dad. He says he's relying on medical staff like nurses for information.
They're the heroes of society. What they need or what they feel they need to do their job safely or to do their job more successfully. Like I couldn't imagine that. I couldn't imagine a request too large.
I reached out to the Nevada Hospital Association requesting an interview to discuss the COVID-19 surge and how hospitals are dealing with it. I did not receive a response. You can find the full statement from St. Rose at 8newsnow.com. Reporting live, Vanessa Murphy, 8 News Now.